Welcome, everyone. Thank you for joining the American Migraine Foundation and Gillean Dean and myself, Eileen Brewer. Tonight, we're here to talk about cluster headache. In a minute, I'm going to let Gillean introduce herself, but I want to tell you a little bit about how our evening is going to go. First, I'm going to ask Gillean some questions about what it is like to live with cluster headache, and we'll learn a little bit more about what cluster headache is. Then I'm going to tell you a little bit about my organization, Clusterbusters. At the end, we'll have time for Q&A. If you have any questions while we're going through this, please feel free to put them into the chat, and we will be monitoring the chat and answer your questions as we go through and at the end. I hope you all enjoy your evening, and thank you so much for joining us. And now, Gillean Dean, will you introduce yourself?
Hi, I'm Gillean, and a little bit about myself. I'm a writer, an advocate for as many organizations as I can, and a big fan of American Migraine Foundation, of course. And I'm a gardener and hiker. I live in the forest, and so I have everything I want here.
I am so excited to be here with Gillean this evening. I've been following her on social media for years, and she has been an inspiration to me. I'm Eileen Brewer. I'm the president of Clusterbusters, but I do not live with cluster headache. I do live with chronic migraine. And I am a mother, I am a hiker, I play video games, I'm a Girl Scout troop leader, and I'm really excited to be here to talk about cluster headache. Gillean, I'd like to start by asking you, what is cluster headache? Can you describe an attack?
Yes, it is usually a very sudden, very sharp pain, and for me, it's always on my right side, left side, and it's a very sharp, very intense pain right in the eyeball. It's like somebody has stuck a hot poker right into my eye socket, and I have very little warning. Sometimes I have a couple minutes warning. I get it ghost pain, and I know it's coming, and I can get somewhere quiet. But often it will stop me right in the middle of a sentence, and you'll see me grab my face and start to rock. And the pain it's incredible. It's the worst thing I've ever experienced in my life. And I do want to say that I also have chronic migraine, and even my worst migraines, as migraine is not headache, cluster headache is not migraine. There's a very, very distinct difference. When I have cluster headache, I cannot sit still. I often bang my head on things to try and stop the pain or knock myself out. My left eye and my left nostril, it's the oddest thing, will start to run. And all I can really do is just go somewhere dark and quiet, and hopefully no hard objects are around that I can crack my head on, and let it until it passes.
How long do your attacks usually last?
They're one after another for maybe at most, I think 2 hours and 40 minutes was my longest attack.
That's unimaginable to live with that amount of pain for that long. I've seen it, but I've never experienced it. And so for everybody who's listening, my heart goes out to you for trying to cope with that. Like you said, you have been diagnosed with cluster headache, but you also have a migraine diagnosis. Can you tell me a little bit about your journey to getting a diagnosis? Like, how long did it take? And what were you diagnosed with, and how long did it take to get an accurate diagnosis?
Right. It took me a long time. For me, it started with pain that would just hit me suddenly right in my eye and was really severe. I mean, if I'm driving, it just makes me, try not to close my eyes. And And I really thought it was just a short migraine, and none of my doctors knew or really believed what was going on. And they just said, oh, it's just migraine. And it got to be more frequent. It would happen more frequently. And they would start to last longer than just a few minutes, maybe 10 minutes. And I kept trying to tell the doctors that, okay, these are getting worse. And the first, I think what I would actually call cluster headache was 2008, where I realized, okay, this is something much more than migraine. And it wasn't until 2017 that I was properly diagnosed with cluster headache.
Wait, did you just say 2008 to 2017? That's 9 years.
Yeah.
Oh my gosh.
It took 9 years to get diagnosed, for somebody to believe me. And when I went in the room, I spent not even 2 minutes explaining my symptoms. And he says, oh yeah, you have cluster headache. After all these years, he just very quickly, he just knew. And it was a specialist. I finally went to a specialist. It's difficult with insurance, as a lot of us know, to get in to see a specialist. But when I finally did, he just very quickly knew cluster headache. And it was such a relief to, I didn't want something to be wrong, but it was such a relief to know what was wrong. And it's, the next step to figuring out, okay, now we know what it is. What can I do? How do I survive this? It takes a piece of my soul every time. To finally get a diagnosis was such a relief.
I can understand that, but I don't know that tell me a little bit about your treatment plan right now. Is a diagnosis, it is helpful, but how is it helpful? And tell me about your treatment.
Sure. What works best for me is it's oxygen. It's a very simple thing. There are medications that people try. I know Emgality is something that people have had some success with. However, it requires a much higher dose than would normally be prescribed for someone with migraine. But for me, oxygen works. I have an enormous tank beside my bed. I carry small tanks in the car with me in the trunk, and I use a special mask that was designed by somebody with cluster. It's a non-rebreather mask, and I use high flow oxygen. And whenever I get an attack, if I can get to my oxygen, it can keep it down to maybe 15 minutes rather than 2.5 hours.
Wow, that's incredible if you can get there.
It seems like something so simple, but it's amazing. Oxygen. I laughed at the doctor when he said oxygen. And it was hard to get the prescription. It was hard to get it filled because people said, well, why do you need oxygen? And this much oxygen, because I don't want to run out.
Right, and the flow of oxygen is higher than you see people with a nasal cannula and people with COPD, they're using 3 liters per minute or something like that, whereas somebody with cluster headache is using 10 or 15 liters per minute. And
sometimes I'll go as high as 20. I got a special nozzle regulator for my tank so that I can have high flow, because normally the normal regulators on the tank don't let you have the high flow. So it needs a different regulator because so that you can get the 15 to 20.
Right. And you don't have an oxygen concentrator in your house, do you? Or do you have an oxygen concentrator in your house?
Well, no, I don't. And I live in the mountains and the power goes out a lot. I mean, for any number of reasons. So even if I did, I'd be in trouble. So oxygen takes no power.
And oxygen concentrators also don't give you the higher flow that you need or the pure enough oxygen that you need. So
I didn't even know that.
I do know that. Yeah, oxygen has been a big issue because of access issues. Getting the prescription and then getting the understanding from the oxygen company, from your insurance company, to be able to get that is a really big struggle. Have you had any other struggles with your insurance company or anything?
Oh, I've had quite a few because not many people know about cluster headache. It's pretty rare. You probably have the statistics more than I do. But yes, with medications, I have tried different medications, and the side effects have been, and I know a lot of people with migraine and other headache disorders can understand that the side effects on some of them were very, very uncomfortable, made me very sick. I was hospitalized for one of them, and one of them made me very suicidal as a side effect. So I have to be really cautious. You know, I want to get better, I want the help, but it's that balance between I'm afraid to take it because what about the side effects? But if I don't take it, then I won't know if it can help me. So it's that constant battle that I know probably a lot of you can understand that one.
Yeah, I think anybody with a headache disease can understand that
Mm-hmm.
struggle very.
And the insurance and covering the oxygen, and I now have Medicare, so it took quite a while with Medicare for them um, to let me fill as a prescription. And frankly, I was willing to pay cash, but you can't. I couldn't get oxygen by paying cash. It would only go through insurance, and which I find very unfair, and it was very frustrating. And you know, I'm going through all this and having to fight not only the insurance. I finally believed by the doctor, and then insurance. We have to go through that, and then getting them refilled within a timely manner um, to make sure I have backup. It's not something easy to live with.
No, when you're sick and then you're having to fight all of these other battles with the system, that's just unimaginably hard.
And then add migraine on top of it.
Right, which is
And the
another
frustration
battle.
gives me the migraine. And
Right. So, how often do you get these attacks now?
well, I get them year round. I know most people with cluster don't have them year round. I get every month. I have at least one attack, if not during high cycles. I have two. Generally, cluster headaches, as I understand, Eileen, correct me if I'm wrong. Cluster folks have high cycles in spring and fall, where a number of attacks dramatically increase, and maybe they don't have them any other time during the year. It's cyclical. For me, my high cycles are summer and winter, so I'm just coming down off of a high cycle. So I'll go back to probably having them maybe a couple times a month, which is a relief. But
Yeah.
and yeah, during high cycle, it's curious because I can set my clock Tuesdays and Wednesdays. If I have attacks on Tuesdays at 6 o'clock, I'm going to have attacks on Wednesdays at 6 o'clock. I can almost set my watch by it.
And that's really typical. Cluster heads say that, like when they are in cycle, which is what you call these high periods, when they're in cycle, they talk about, well, I know that I'm going to have an attack at 2 a.m. and that's just what's going to happen every day for however long this lasts. And so they prepare for it. They're like, I've got my oxygen by my bed. I'm ready to go for this attack that I know is coming. But I just think it's awful knowing that you're going to get this kind of attack.
The dread of knowing the evenings. If I get agitated, because I'll have ghost pain all the time, often, where I think, uh-oh, gonna have a cluster headache. There's that pain, and it's kind of like a feeling of I need to sneeze, but then you have that full I'm gonna sneeze symptoms, and oh, no sneeze. But with pain, it's the only way I can kind of compare it to maybe help people understand is I just feel like I'm gonna have a cluster headache at any moment, and I stay home. I had a career for 30 years of human resources, and I had to stop working since 2018. I haven't been able to work because of cluster and migraine, and it makes it hard to want to leave home with these ghost pains that last all the time.
So
does that make sense?
It does. And actually, so the common term for this ghost pain that you're describing is shadow. That's what a lot of people use, is their shadows. But I love ghost pain. And the way that you describe it, like, made me understand better than anybody has ever been able to describe it before. So thank you for that, because I just learned something about what that's like for you.
You're welcome.
Yeah. So talk about what happens when you do go out. You say that you stay home a lot, but you must leave your house and go to the grocery store, go to the mall, go places. What do you do? How do you prepare for that? And what happens if you get an attack when you go out?
Well, when I do go out, it's because I feel well. And so I forget. I tend to forget that I have this disease, and I am prepared. I have oxygen in the trunk of my car. But sometimes when I am in a grocery store, a loud noise will happen, or just I'm driving along, minding my own business, and wham, there I go into a full cluster, and I have a couple minutes, and it's happened to me twice while driving. So I both times have been able to pull over safely, just barely, and then get the oxygen. If I can safely get out of the car, I would get the oxygen, but these two times I was not able to. And so one of the times I had a lovely Good Samaritan stop and ask if he could help, and I couldn't answer because all I could do was hold my head and scream. And so he kind of freaked out, as you could probably imagine. And so he called an ambulance. An ambulance came. I couldn't explain to them what was wrong. They asked me what I needed. I said oxygen, and they tried to give me oxygen, but it was just a little regular mask with low flow oxygen, which didn't help them. So I told them no. And then they took me in an ambulance to the hospital. The emergency room asked me, what's wrong? What can I do? I tried to tell them cluster headache. There's nothing you can do. So they put me in a bed in a hallway where nobody else could hear me scream. And when an hour later, when it was done, I just walked out with this enormous hospital bill. Then I had to find out where my car had been towed. It's incredibly disruptive, and it's embarrassing too. I know maybe I shouldn't be. It's my body. I can't help it. I didn't ask for it. I just live with it. But I don't want people seeing me like that. It's incredibly vulnerable. It's humiliating, and people don't understand. They don't. I even have my medical bracelet. I have a medical bracelet that I use, and I try to show, and I have a medical card in my wallet, and I'm going to make a magnet so that I can stick it on the side of my car, or a sticker that can stick on my window that says, I'm okay, I'm having a cluster headache, please don't call for medical help, it will pass, and thank you for your concern. Friend of mine said I'd probably call an ambulance anyway just to make sure you're okay, but just
But those are some good tools that you have. That like your medical bracelet, that's a great idea. And having a card
Mhm.
in your wallet, you know, having a card that explains a little bit about what a cluster headache is and why you're behaving that way. Maybe if there's a little bit of an explanation, your friend would read that and not call an ambulance and just, you know, try and help you get your oxygen or something.
And another time, the paramedics did read my bracelet, and they knew that they actually had high flow oxygen and a non-rebreather mask. I was amazed. And so it helped me get over it very quickly, relatively quickly, 15 minutes. It seems like, trust me, it seems like an eternity. It's hell. However, when it was over, he said, "Thank you, you." And then I discussed with him what cluster headaches were, how I was diagnosed, and he said, "Please tell me what I can do for patients I come across this." And so I told him the high flow oxygen non-rebreather mask, and he said, "Thank you." So I guess in a strange way, I performed a community service, um, helping them understand what they were, and that they could help somebody else in the future.
Yeah, a cluster headache is, we'll say it's rare. It is rare compared to migraine. Migraine, there's 40 million people walking around with migraine, and that's a huge number of people. That is epidemic proportions there. People, there 1 in 1,000 people have cluster headaches. So maybe 350,000 people in the U.S. live with cluster headache. So most people don't encounter somebody who lives with cluster headache. And because you don't want to be seen with a cluster headache, most people are never going to see a cluster headache attack. So that actually is valuable. Like if you go on YouTube and you look for people having a cluster headache attack, there's a few videos that we share over and over again because nobody wants to be videotaped while they're that vulnerable and going through that. So there's not that many resources to show people what this is actually like, and it's horrifying. Seeing somebody with a cluster headache attack is awful, and there's nothing you can do except get their oxygen and hope for the best, you know.
My husband says, as well as for me, it just feels like it steals a piece of my soul going through it. But for him, he said it does for him as well, watching me go through it and not being able to help. He does help. That's what he doesn't understand, is being there, making sure I have the oxygen, making sure I don't crack my head on something. That is doing something, but it still takes a piece of his soul as well.
Yeah. Well, he loves you. It's clear.
He does.
And that's wonderful. Having a good partner is always a good thing if you can. And
Yeah, he's amazing.
you mentioned something while you were talking about being out in public, having an attack that was interesting to me, and I'd like you to expand upon it a little more. You said loud noise triggers attacks for you. And I know that triggers for cluster headache are not like triggers for migraine, where triggers for migraine, there's a long list of potential triggers for migraine, and they can trigger a migraine anywhere from like an hour after to like 72 hours after you encounter the trigger. But for cluster headache, I know that it's different. Can you talk a little bit about your triggers and how they affect you?
Sure. My triggers, stress can can trigger, as in migraine, but it has to be pretty intense stress, and it's relatively easy to link the two because there's not much time between, a super stressful day, you get home and a couple hours later, bam. Is it the stress, or was it your time to have it anyway? Uh, Sometimes it's hard to tell. However, for me, number one trigger is loud, sharp noises. Like, I can be watching a movie and somebody rings a little ding a ding a ding, a bell, and snap, there I go. Or one of the worst things in a grocery store is if those bread trays that the plastic trays that the bread come in, whenever the folks that are loading the bread drop one of those trays on the concrete, it goes snap. Or they drop a case of Cokes and that loud noise is a trigger, and instantly right there, if I'm alone, I have to, through tears, I'm tearing, I've got snot running down my face, I've got to leave my groceries or leave whatever I'm doing, pumping gas, a siren, some emergency vehicle goes by, and there I go, and so I have to stop whatever I'm doing. That's a big trigger for me, is noise. Have you heard anybody who has the noise as a trigger?
One other person ever.
Really?
Yeah. And I've met probably several thousand people that live with cluster headache through my work, and one other person ever. So that's a pretty unique trigger. But there are other people who have unique triggers like elevation or pressure changes, which is common with migraine as well. Can
one
trigger.
Of mine as well when storms come in.
Mm-hmm. Alcohol is one of the most common triggers that we hear about people who are not, if you're episodic, not chronic like you, but if you're episodic and you're in cycle, drinking alcohol will trigger an attack almost immediately for many people. But if they're not in cycle, they can drink all the alcohol they want and it's fine. So that's interesting. So I've only met one other person with your trigger. You got to be unique, don't you?
Oh, don't I though? Yeah. Year round, a rare trigger just
right.
has to be special, don't I?
Right. Yeah. And chronic cluster headache, like you live with, is rare. It's maybe, I think, 6 to 10% of people who live with cluster headache have chronic cluster headache. Episodic cluster headache is more common. Like you mentioned, generally people have cycles in the spring and the fall. That's not true for everybody. Sometimes people have cycles, other times throughout the year, but spring and fall is more common, which is why we celebrate Cluster Headache Awareness Day on May 21st, which is the first full day of spring. We want to bring awareness during that time, or not May, sorry, March, which is the month it is now.
Right.
I am starting to have a migraine attack, so I'm going to lose words, and I'm really sorry about that.
That's okay.
But yes, March 21st is Cluster Headache Awareness Day. So that's why we're here talking about this in March.
Perfect.
Let's see, do I have any other questions for you? Is there anything else that you'd like to tell people about living with cluster headache?
I wanted to mention there's also a vitamin D regimen that I take. It's supplements, and off the top of my head, I can't, because I also am recovering from a migraine, so I don't yet have my words. But it's a vitamin D regimen, and I take it year round, and I believe I am not as bad as I could be once I started that regimen. And can you mention the doctor, what's it called? Do you remember?
So the vitamin D regimen was developed by a man named Pete Batcheller, who goes by Batch. He is an amazing guy. He used to be in the military. I think he was like a pilot or something. I'm sorry, Pete, if I'm like totally butchering your background, but he's an amazing guy who developed this regimen after doing a bunch of citizen science research. And now Dr. Mark Burish in Houston is studying this regimen in a more clinical fashion. But it does seem like there's tons of evidence that this vitamin D regimen is effective at helping people reduce the frequency and severity of their cluster headaches. I wish that I had included a link for that, but we can post a link for that later or something. I don't know how that'll work, but
when it goes out on YouTube, we can post that.
It's definitely something to check out as an alternative. One thing that I do want to mention about the D3 regimen is that at first you might want to mention it to your doctor, obviously, because they're going to want to check your D3 levels and make sure that you're not using too much D3, and there's other vitamins in the regimen. So you just want to make sure that you're careful. And with any treatment, always discuss it with your doctor first.
Always. And I know that they are studying psilocybin as, I hope we're allowed to mention that.
Well, let me talk a little bit about Clusterbusters and what it is.
Oh, there you go. Good segue.
Yeah. Clusterbusters is an organization that I am president of. It was founded by a man named Bob Wald. Bob Wald, about 20 years ago, was on message boards way back before we had Facebook, even before MySpace. He was on message boards. And there was a guy in the UK who got on the message board and asked if anybody had found that psychedelics helped with their cluster headaches, because he had recreationally used LSD and he skipped an attack, or he skipped a cycle. And he was like, does anybody know anything else about this? And Bob Wald read this post and he started asking around, and other people started trying it. And out of that, he formed Clusterbusters to tell other people about this and to start gathering data about this. He took that data to some researchers at Harvard in 2005, and they performed a study of LSD, or was it psilocybin? It might have been psilocybin. They performed a study of cluster headache, a pilot study. Out of that work, it has grown to include studies at Yale, including the VA, for psilocybin for both cluster headache and migraine. And that was the foundation of Clusterbusters. Now, Clusterbusters has since grown to offer support and education and awareness for anybody living with cluster headache. We're not just about psychedelics. We are about any treatment for cluster headache. Like I said, we include the D3 regimen on our website. We include information about Emgality and Gammacore, which are the only two approved treatments for cluster headache at this time. We include information about oxygen, which is also an approved treatment. Well, it's not really approved. It's just something that we know works. And now CMS has said, yeah, you can have that if you want it. For a while, that was a challenge because CMS,
and what is CMS?
The Centers for Medicare and Medicaid Services, right, said that there wasn't enough evidence of efficacy for oxygen, despite the fact that it's been used to treat cluster headache for more than 100 years. The reason there's not evidence is it doesn't make sense to study it at this point.
There's so few people that have it.
Exactly. And also it would be hard to study because find somebody living with cluster headache who hasn't tried oxygen. Mm-hmm. Find somebody over 65 years old who has cluster headache who hasn't tried oxygen. It's impossible. Finding enough people to perform a randomized controlled clinical trial on that would be, it wouldn't happen. And then finding somebody to fund a randomized controlled clinical trial for oxygen. They're not going to make any money off of it. So why would they spend the money on it? So we've managed to get the Centers for Medicare and Medicaid Services to see our point of view and approve oxygen for cluster headache, which is great. So Clusterbusters will talk about any research that's going on about cluster headache. We help people design clinical trials because cluster headache is unique because people are only in cycles for certain amounts of time. Even you, although you're chronic, with your high cycles and low cycles, you need to have enough attacks to be able to participate in a clinical trial appropriately, and that's hard to do. So we help people navigate studying cluster headache, designing their studies around this unique population. We also fund surveys. We discovered years ago that there's a substance called BOL 148 that was used as a placebo in a clinical trial, but actually worked better than the thing that they were studying. And so now we're driving research into BOL 148. We do surveys to improve the our knowledge about cluster headache, because while I said 1 in 1,000 people have cluster headache, that's a guess. There's never been a really good population survey about cluster headaches, so we don't really know. Also, there's a lot of misdiagnoses with cluster headache because a lot of women are misdiagnosed with migraine when they really live with cluster headache, like you have
Because
faced.
more men have it than women.
We're
Is that right?
finding that that's not actually true. But where it used to be like 1 out of every 5 cluster headache patients was a woman, but now it's more like 2 out of every 5 or 3 out of every 5 are women. So it's not what we thought, and it's just because of the misdiagnosis. So as we're performing more studies and questionnaires and research, we're learning more. So Clusterbusters loves doing that. We have a conference every year. We actually now have 2 conferences every year. It's really exciting to tell everybody. So we have a conference every year. It happens in September. This year it will be in Orlando, Florida in the United States, but in just over a month, I will be going to Glasgow for our first ever European conference. So we like to bring patients together just because most people living with cluster headache have never been in the same room with somebody else living with cluster headache. They've never met anybody else living with cluster headache. So we like to bring people together. We do education, we do support groups, we do advocacy activities. Advocacy is huge. Like we're talking here today about cluster headache and raising awareness for it. Sometimes we go up to the hill and do headache on the hill and talk about cluster headache to people who have never heard of it before. We're also working on state and federal policy regarding psychedelics right now because that is becoming a huge topic of conversation. As we know, Oregon just passed legislation about it, as did Colorado. So we're trying to engage so that as laws change regarding psychedelics and as our research progresses regarding psychedelics, cluster headache patients will have the access that they need to get these substances when they are approved by the FDA.
Thank you. Oh.
I say when, and that's hopeful.
Yes.
We're probably 10 years out from that at this point.
That's okay.
It's okay. We're gonna keep driving the research and see how it goes. We also have guides on our website. There's a treatment guide if you want to learn more about the treatments that are available for cluster headache, like the ones that we've talked about tonight. There's also a guide about how to use oxygen, because Gillean, she gave a very good overview of what the mask is like and all that. There's pictures of that mask. There's links of where to get that mask. There's also, I think you talked about the different like regulators for the oxygen tanks, like all of that. Like this is like stuff you have to learn how to do. It's not like common knowledge, like what to do with an oxygen tank. And it's pretty scary when you're faced with one for the first time. So there's a learning curve. So we try to help with that. If anybody here is wondering if they do have cluster headache, if they've been misdiagnosed after hearing Gillean's amazing story, there's also a tool on our website that was developed by Dr. Morris Maisel, and it can help to accurately diagnose your headache disease. So even if you don't think you have cluster headache and you think that migraine also doesn't fit your symptoms, you might be able to use this tool. It's called the Chat3 tool, and it's a kind of a long survey. It takes about 20 minutes to go through, but it can help you to really fine point and your diagnosis and give you tools to go back to your doctor and talk to them about what's really going on. So then you too can have a conversation like Gillean had, where she went in, talked about her symptoms, and then the doctor was like, oh, that's cluster headache. So that's essentially what Clusterbusters does. We definitely want to offer support to anybody who needs it. So you can always reach out to us at info@clusterbusters.org if you have any questions, and we'll get back to you. AMF also has a ton of resources for you. Even though it's the American Migraine Foundation, they have articles about cluster headache. They have guides about treatment for cluster headache, and they also have a find a doctor tool, which is the awesomest thing because it's up to date and it can help you to find a doctor that is more aware of how to treat headaches than your general practitioner, than your general neurologist even. If you think you have cluster headache, you really want to try and get to somebody who has special knowledge of cluster headache, and the American Migraine Foundation can help you to find that person. We've talked a lot. Are there any questions?
Yeah, we did.
I haven't seen any.
If there are any. I did want to mention, in the meantime, if there's a few more minutes.
Yeah, we have a few more minutes.
Meditation has really helped me, I didn't start meditation with this in mind, but meditation does help me during an attack. If I can focus on just going somewhere dark and quiet in my mind, like I liken it to the eye of a hurricane, where it's safe. The cluster's going on around me and all the pain, and I still know it's there. It's kind of out of body almost, where I just go to this dark, quiet place where I can keep my sanity safe. And while this just brutal hurricane of pain is going on in my head, so I've noticed that meditation has really helped me with that. Doesn't take away the pain, just helps me cope mentally, emotionally.
I like ending kind of on a note of talking about mental health, because as everybody knows, if you're living with a disease like this, your mental health is going to be affected by it. And a lot of people with cluster headache also live with post-traumatic stress disorder because they're always living in fear of that next attack, and they are just like, they become scared of life, or scared of going to sleep, or scared of whatever. So
I'm scared of the evenings. I'm scared of going places. I have what is it? My words. The depression. I'm sorry, I've lost my words on that one. But depression, anxiety, and PTSD diagnosis, because it's the dread. And sometimes I feel like maybe the dread brings it on. I don't think so, but living in dread and not wanting to go anywhere because you don't want to be around anyone. You just want to be comfortable at home if this happens, somewhere safe.
Yeah, so, it sounds incredibly isolating. So if you, we do have a question. But if you are experiencing if you are living with cluster headache and you are experiencing any mental health problems, definitely reach out to somebody, get some help to deal with that, because there's no shame in it. Everybody who lives with a chronic pain disease needs to also cope with their mental health. And it's not that anybody's saying that your mental health is causing this disease. It's just saying that you need to take care of that part of you as well. So definitely reach out for help if you need help with that as well.
Because it can make it very, very hard to want to live with life with this.
There's a reason it's nicknamed suicide headache.
Yes.
If you're contemplating suicide, definitely call suicide hotlines. They are specifically trained to help people with cluster headache separately from how they would deal with somebody who was living with depression or anxiety or something. They are specifically trained to understand cluster headache because of the efforts of Clusterbusters. So definitely call. They'll be able to give you resources. John has asked, am I correct that there are no preventives for cluster headache, only pain relief? Unfortunately, that's incorrect. Emgality was the first approved, FDA-approved treatment for episodic cluster headache. It is a preventive. It's a shot that you take once a month, like Gillean mentioned earlier. It's a different dose than you would take for migraine. but you take it when you think you're about to go into cycle or when you think you're about to go into high cycle, and you take it every month just like you would for migraine disease.
And as far as I know,
in addition, Gammacore got clearance from the FDA for preventive treatment as well. And Gammacore is a device that you hold it up to your neck. It's non-invasive, and it stimulates your vagus nerve. And for some people, it does help to prevent cluster headache attacks.
But there is no medicine for pain relief for cluster.
No, none of the medications work. I mean, sumatriptan can sometimes abort an attack for some people, but you can't, if you're having 8 attacks a day, you can't take sumatriptan 8 times a day. Opiates, strong opiates don't touch the pain. There's no pain treatment. So oxygen is honestly the best for acute treatment, but there are a couple of approved preventives. How do you tell the... Go ahead.
Oh, sorry. And Lorraine is asking how to tell the difference between cluster headaches and migraines if you have both. I can speak to that.
Yeah.
Is migraine, the best I can say is migraine is to, just like migraine is not a headache, cluster is not a migraine. There's an enormous difference. It's the most intense pain that you've ever felt. People with cluster people with cluster who have been shot, stabbed, have had children, have had broken bones, have said cluster is worse than any of those. So I hope that's a helpful explanation for Lorraine.
Yeah, I can also say that like there are some direct comparisons you can make. If you want to lay down and be still and be extremely quiet when you're having an attack, that's more likely to be a migraine attack. If you're pacing and restless and wanting to hit yourself in the head repeatedly, that's most likely a cluster headache attack. If your attack lasts longer than 3 hours, then that's probably not a cluster headache attack. Cluster headache attacks are brief, and they start and end very suddenly.
They do.
Whereas a migraine can ramp up over time. You have the different phases of migraine, and then can slowly go away over the course of up to 72 hours. So it's just a very different, including the quality of pain. But cluster headache doesn't come as often with confusion, nausea. It does sometimes come with nausea and vomiting, but it doesn't come with all of the other sensitivities that are characteristic of a migraine attack. You still have like the tearing and the nose running and stuff, but those are all autonomic symptoms. So they're just different headache diseases. Amy, I mentioned the vagus nerve. There's a couple of nerves that we think are at play with cluster headache, and the vagus nerve is one of them. And you can access the vagus nerve through this point in your neck. There's training on how to use the Gammacore device. It looks like we're over time. So I just want to check in and see if there's any more questions or if we should end.
There are online support groups in Facebook for cluster. I did want to mention that.
Yes.
Episodic versus chronic. You're going to have to talk. My TN is, I can't talk anymore.
Okay, so first of all, Yvonne, she's asking, what is episodic versus chronic? I was diagnosed 2 years ago, and there are no doctors that I'm aware of close to me that is familiar with cluster. So first, episodic is when you have a cycle that lasts, say, 2 or 3 or 4 months, and then you have a period where you do not get any cluster headache attacks for at least 3 months. That's just the textbook definition. Chronic is when you have attacks that are more frequent than than that, when you don't have any periods of no headache attacks, of no cluster attacks. As far as saying there are no doctors that you're aware of close to you that's familiar with cluster, I'm sorry, that's really typical. There's only 500 and some headache specialists in all of the United States. And like I mentioned earlier, there's more than 40 million people living with headache diseases. So there's not enough doctors for all of us, and it can be a desperate situation. There are, I don't know if I'm allowed to plug online doctors, but I believe that, is it eNeura, is an online doctor program that will treat cluster headaches virtually as opposed to in person. So that may be something to check out. In addition, what you can do if you really can't find a doctor that is familiar with cluster headache is educate your doctor about cluster headache. Start printing out resources and going into your doctor and being like, can you read this? Can you help me? Have you considered high flow oxygen? Here's the research, here's the information, and here's what the prescription looks like. We have a picture of a prescription on our website that you can just print out and take to your doctor and be like, can you write me this prescription? We're just talking about oxygen here. And we're not talking about me using 15 liters per minute of oxygen for the next 10 days. I'm going to use it for 15 or 20 minutes and then get off of it. So print out those resources and take them to your general practitioner and just explain to them that, you know, you can't find somebody who's knowledgeable, so let's work together to try and help. And if all else fails, give me a call personally. I will help you through it and figure out how to get you the care that you need. Any more questions? Just going to wait patiently for a minute and make sure that there are no more questions. I want to make sure everybody.
I can't say enough about American Migraine Foundation and Clusterbusters and how much I learned. I thought I knew quite a bit. I tried to educate myself, and I thought I knew quite a bit until I started to really look at both organizations. And I had a dear friend that I met through Facebook support group, and she turned me on to Clusterbusters, and I learned so much, and I don't know if I'd be here if it weren't for that dear friend, and she knows who she is. So I want to shout out.
That's, I think I know who that dear friend is. And
yes.
We'll just give a shout out to her from our hearts because she's amazing. There are no other questions. So I just want to say thank you so much, Gillean, for being so brave as to share your story with us tonight. It's really, I've learned a lot. I hope others have learned a lot. Thank you to the American Migraine Foundation for giving us this platform to talk about this disease. Definitely. And the impacts of it. I hope that everybody has a great night, and we'll talk soon.
Happy
Happy Cluster Headache Awareness Day.